guys. So I wanted to bring you this video today to talk about 3 things that sound crazy, but actually work for your hair. Now you have to understand, as a dermatologist who specializes in hair loss, I get a ton of questions from patients about different things that they've read about on the internet, and they all want to know, well, does it actually work? So I do want to tell you about 3 things that sound a little bit crazy, but are actually effective. The first is a red light laser device. So you may have seen these on social media. You may have seen a red light laser cap. Sometimes they come in the form of a brush or headband, but these devices can actually be pretty effective at stimulating hair growth. This is particularly if you're suffering from a type of hair loss called male or female pattern thinning. It's thought that these devices work by stimulating blood flow to the hair follicle, thus thickening up the hair as it grows from the scalp. These devices can be pretty pricey. They range anywhere from about $500 to up to $2,000 or $3,000, but they are one of those things that once you buy them, you have them forever. Depending on the type of device that you are purchasing, you may find yourself having to use it 3 to 5 times a week, anywhere between 90 seconds or 15 minutes per session. Now, I don't recommend low-level LED light devices or red light laser devices as a sole treatment for pattern hair loss, but they can be helpful in addition to other standard treatments like minoxidil. The second thing I wanted to talk about is the use of sulfur for dandruff. So there's a very popular old school hair grease called Sulfur 8. And a lot of grandmothers would say, oh, if you have a little bit of dandruff, just use some Sulfur 8. And so my patients will come to me and they're like, I've been using Sulfur 8 for my dandruff, but is that real? Well, yes, it is real. So sulfur is actually quite effective at treating dandruff because it can really help decrease yeast counts that are partially the cause of dandruff, and the type of yeast is called Malassezia. So as dermatologists, we will sometimes prescribe sulfur washes for people who have dandruff on the face because it's very, very common on the face. But on the scalp, this Sulfur 8 hair grease can be really, really effective, and this is super helpful, particularly in those of us with curly hair, because a lot of anti-dandruff shampoos can actually strip sebum and can make curly hair very dry and prone to breakage. So looking for treatments that are not going to dry out the hair can be really, really important. And the last thing that sounds super crazy but can actually be very effective is the use of antifungals for hair growth. Right? And so I first became aware of this because there was a celebrity who mentioned that she applies Monistat 7 to her scalp. It has thickened her hair. I have nothing to say about Monistat 7. I have no idea if Monistat 7 works. However, there is some rationale behind that. So Ketoconazole, which is an antifungal medication, has been shown to thicken up the hair and lead to hair growth, particularly again in people suffering from female or male pattern thinning. One thing to know about female and male pattern thinning is that it affects everyone because it's actually an age-related process. So all of us are going to have a little bit of age-related thinning, but for some people it's more prominent than others. It's really unclear exactly why ketoconazole is effective. It's possible because it has some antimicrobial activity by decreasing these yeast counts, and maybe these yeast play a little bit of role, but really there's no definitive data. And so it's really, really hard to tell, but in my clinic, I will often prescribe ketoconazole shampoo to my patients who have early signs of male and female pattern thinning, especially if they have straight hair. Again, as I mentioned previously, a lot of anti-dandruff shampoos can be very drying and can break hair if your hair is curly. So I would not recommend a ketoconazole shampoo, but in theory, you could use a ketoconazole cream and apply that to the scalp and see if it helps. So it sounds crazy, but there is some scientific data to support that approach. I hope that these 3 tips have been helpful for you. And if you have any questions, feel free to leave them below. Take care.